Oh yeah, it's allowing now. Okay, hi. So just to recap, so this is I run WESIE Integrative Pharmacy, which is connected to WESIE, and we're an integrative pharmacy. Our goal is to bridge the gap between medications, herbs, supplements, and well-being, which a lot of people nowadays want to use, but mainstream often just focuses on the medication side of things. So that's what we do. And we also offer a range of prescription-only medicines. Although we're an online pharmacy and we do consultations remotely, we do like travel medicine, antimalarials, women's health, and we offer a range of herbs and supplements to complement some of those things for people that may not want to use a medication or may just want to try a herb. And, if you're on medications, obviously we'll check and make sure that it's safe for you to take. And if it's not, then we'll try and give you the right advice to solve your problem. So that's a brief summary of who we are. Just bear with me. So today, I think Leanne wanted me to touch on the medication. So what I thought we would talk about is just HIV in the context of anti-retroviral side effects, because I think the two go hand in hand. And the reality is that a lot of the things that HIV causes, sometimes the medications can also cause. And so sometimes in practice, it's a little bit of a challenge in terms of getting the balance right and saying, oh, is it actually the HIV or the medication? But more often than not, when people are stable on therapy, then the first thing you think about is whether it's the medication causing the side effects. So today I thought we would just cover the common links between HIV and antiretroviral therapy, and then have a chat about the short-term side effects, the long-term side effects, and ways by which you might be able to manage those side effects. So let's just refresh, and this is a really simple diagram of what goes on in HIV, and I'm sure some of you would have seen other diagrams or had this explained in different ways, and I've tried to just really simplify it in my head in a way that it makes sense in the context of what we're talking about today. So obviously, I'm sure you've all heard about this. The first thing you hear about is HIV affects your immune system, and what it does is two things. It attacks the immune system, so it kills off your cells, so your cells are not producing the way it should, so you're not able to mount a normal immune response against other things. But on the other hand, the cells that are remaining do become overactive, and so it's kind of like a double whammy. And then what this does in the body, and what you see in the body, is this is why you become more vulnerable to other infections. So widespread infection, because you don't have much of an immune system. What we don't talk much about, which also happens and which continues to happen, albeit at a lower rate, even when you're on treatment and you're stable at treatment, is the inflammation. And inflammation, a simple way of thinking about inflammation is if you have a cut or a bruise, the way your body reacts, you'll see that it will turn a bit red, maybe get a bit swollen, etc. And, like that happens on the outside, and a similar thing can happen on the inside. And as a result of this inflammation, it affects different parts of your body. So in terms of your organs, in terms of, your body functionality, hormones, etc. That's what we start to see happening. With treatment, things get a bit better, but the difficult thing is you still have, even when you're suppressed, you still have a very low level of this thing going on in your body, persistent. And then you have a low level of this going on. And then the medications, as you already know, also have their own impact. So together, these things cause hormonal imbalances and they cause stress. Stress, I look at it in two ways. Stress from an external point of view, because you're obviously, a lot of people, when it comes to sicknesses, not just HIV, I see it with mental health, you see it with cancer, generally speaking, with sicknesses, people don't like to share it, and people feel under that additional pressure because of the nature of HIV. So that's a stress on your mental well-being anyway. That's a stress that people learn to live with. And then But there's also internal stresses, things going on in your body because your body's not functioning as it should, normal, because we're trying to do a few things artificially. On balance, they give you life, it makes you well, you can live longer than before. However, you know, because of this thing and the drugs and the persistent things, your cells are still under stress. So that also makes you more vulnerable. And the end result of this combined together is obviously your well-being may not be 100% or what it can be without it. And then aging. You may or may not have heard of this, but widespread infections, inflammation, where your body is constantly having to fight things, it increases the rate of your aging. And with that comes the increased risk of things like heart disease, like kidney disease, like diabetes, all sorts of things. So that's what happens with HIV. And so, like I said here, the medications, unfortunately, don't fully reverse. They do a good job. I can't imagine life without them, but they don't fully reserve or stop this process from happening. And they in themselves can affect some of the processes. So that's my really simple explanation of HIV, what's going on, and the common link with the medications. So let's talk about side effects now. So short-term side effects, these are things that many of you, I'm sure, would have experienced at some point in time. And you may have or even experienced it with other medications, not necessarily just HIV, but obviously being on it long-term, etc. It's a different kettle of fish. So one of the more common ones people tend to get is an upset tummy. And this may manifest as something like diarrhea, you feeling a bit nauseous, some people actually throwing up, wind, indigestion, those kind of symptoms. Then you have mood. Some of the drugs now, I say now, but even, you know, as far back as things like your efavirenz can affect your mood. Most commonly, it tends to be a low mood or depression. We don't see so much of anxiety, but every now and again, that can also happen. And then the nervous system. So things like headaches, just fatigue, tiredness, you know, your sleep pattern, not being able to sleep properly, and then weird and interesting dreams, you know, that tend to be really, really real and vivid. So those are some of the, you know, and then your skin. Some medications can cause a rash, things like darunavir, zanavir, quite a few. There are some that can cause skin darkening or a tanning effect. So if you're white, it might look like, a good example is atazanavir. If you're white, it will look like you've got a tan. If you're dark skinned, it might look like you're a bit dark, but the whites of your hand or your soles may change color. It also happens with one of the medications you find in Truvada, emtricitabine. So, you know, these are some of the effects on your skin. And then some of the others, which thankfully aren't as common, but do still happen. I mean, we're able to test as part of your test before you go on medications. We're able, for some of them, we're able to do a test to make sure that this doesn't happen. But every now and again, we can get caught out. And that's your hypersensitivity reactions, which is basically, it's like, as the word says, hypersensitive. So your body mounts a hypersensitive reaction. And very often this will appear as a rash. That will be the first sign, but it won't be like a regular rash. It's the rash that will normally, it will get worse. It may come with itching. It may come with red, different presentations. So what we normally say is if you have a rash, you know, get in touch with the clinic or get in touch and speak to someone, you know, especially, and with the hypersensitivity rash, I've seen it probably a couple of times in my journey as a pharmacist. And quite often with the hypersensitivity rash, it will be a rash with other symptoms. So that is another way of differentiating if you're experiencing it, or if further down the line you're changing meds and it happens to you, is that it would often be a rash with other symptoms. And then occasionally you might get hair loss. Some people might lose their appetite. So those are some of the short-term side effects that you can sometimes get. So now let's talk about long-term side effects, because long-term, I mean, most people, the good thing about the short-term side effects is most times they're short-lived, right? You know, you can get over them quite quick. Sometimes your body will just naturally adapt and get used to the medications and they'll go, or you can take some common simple medications or supplements or herbs to help. The long-term side effects, now these are the more challenging ones. And common ones are, there's probably, I kind of group it into 6. And so there's the weight changes. With the older drugs, we used to see people have sort of what we said were uneven distribution of fat. So bits of their body, like here, they might get a hump, that's a fat, or, you know, and it was really distressing to people that used to get it. So there used to be like a really simple clinical procedure where they're able to, you know, get some of that out. With the newer drugs, so like your protease inhibitors, your integrase, so examples of those are things like darunavir, ritonavir, darunavir, cobicistat, integrase inhibitors like raltegravir, those kind of drugs. What we're seeing now, and dolutegravir, that's another one, another important new one, is people are actually gaining weight, just gaining weight as in gaining weight. And a lot of that is due to some of the, remember I spoke about hormonal imbalances, metabolic disturbances in your body, things like insulin resistance, all those kind of things are some of the things that seem to be contributing to making people more at risk of gaining weight. And then there's the risk to your heart. And we tend to see that a lot with your protease inhibitors and things like efavirenz and abacavir. Now, the reason why your heart risk is affected in terms of your risk of getting a heart disease is because it can affect your cholesterol levels. So your cholesterol levels, we have different parts. We call it lipids. Your lipids are divided into different parts, and some parts of it are actually good. You want to have a decent amount. Others are not so good. You want to have a lower amount. And unfortunately, with some of these drugs, they increase the amount of bad cholesterol that you have, which is what puts you at risk of a heart attack and, you know, heart disease, etc. With the protease inhibitors especially, they can also affect your heart rhythm. So this is another thing that can have an impact on your cardiovascular risk. That risk can also be worse if you're on other medications that can affect your heart or your heart rhythm. And sometimes with some of these side effects, it's easy for us to work on in practice with your clinicians. We'll look at things and try and work. Others are not so easy because they're not always obvious. And, you know, sometimes you work with what you see. And then diabetes, you know, we're seeing that much more frequent in people living with diabetes. In fact, a lot of long-term diseases we're finding are more common in people living with HIV, especially at a younger age. And there are multiple reasons for this. And remember, I spoke about metabolic disturbances, abnormal hormonal imbalances. So that's where things like insulin resistance, if your body is resistant to insulin, you're more likely to get diabetes because obviously your body's not responding to insulin as well as it should. So sugar's accumulating, easier to put on weight as well, and other inflammatory changes. And then another thing we don't talk about is lactic acidosis. And this, sometimes patients in hospital, this can happen in a very severe way and it will be picked up in hospital. But there's also the thought that it could be happening at a really low level with some drugs where it may be affecting the mitochondria. If you can remember from your science class, is like the energy powerhouse of the cell and our body. So if that becomes toxic, there's a risk that you overproduce lactate. And some of the symptoms that you might get with this is tiredness, fatigue, you know, breathlessness, nausea. It can also help you lose weight because basically your body's not able to produce as much energy to carry out its normal processes as it should. So that's another thing that can sometimes happen at a low level. We worry about it more at a practice when it comes at a high level. And then some of the other ones that you may have heard about, because tenofovir which you see in TAF and Truvada, is probably one of the most common HIV drugs used, in that we also use it now to prevent HIV. And you probably would have heard that this can affect your bones, and your kidneys. So we constantly, in practice, what you do in clinic is they'll constantly keep an eye on your kidneys, also your bones, and just make sure everything's okay. If they think you're at a high risk of having problems with your bones, then they'll put you on TAF, which is a milder form of tenofovir. It's a slightly different salt of it, but obviously, like any new drug, with time we start to see that it's not as perfect, and we're starting to see that this as well has its own impact. And then one of the things that you probably wouldn't have heard much about, that we don't talk much about in practice, is that because of the way antiretrovirals are processed in the body, and some of the side effects, they actually can deplete some of the nutrients in your body. So some of the minerals, some of the vitamins, some of the processes that go on in your body and some of the side effects you see is because of nutrient depletion through the antiretrovirals you take. And this ADME, sorry about this, I just couldn't fit it in, but it's like an acronym. So it could be absorption, distribution, metabolism, or elimination. And, and this happens with a lot of drugs, not just HIV drugs. A lot of drugs sometimes can affect these things. It's a bit more challenging with HIV because we don't give one drug at a time. So it's difficult sometimes to say which drug could be causing you to have less of one nutrient. But what we know is that over time, that can also manifest as different symptoms. And I've used vitamin D because I feel it's the easiest example to put into context. A lot of times people with HIV would generally require a lot more, especially if you're Black, especially if you're on certain medications. So this is one of the challenges, and this is why I've pointed it out here. Vitamin D, the level that some of our guidelines recommend, which is good for bone and muscle strength, is actually for some other things, it's not adequate, so especially if you're colored, you need to be taking a lot more. And this is one of the vitamins, I think, in the context of COVID-19, even if you haven't tested, it's something that I think it's worth taking. I mean, I was quite surprised because I got tested just before lockdown last year. I was doing a test, and I hardly go to my GP, but I did a test and I said, throw in some vitamin D. And my level came back and it was insufficient. And I consider myself relatively healthy. And the interesting thing as well is that I started taking, and I took a decent amount, a little bit higher than recommended because of the knowledge I have. And I knew that, I needed to take a bit more. And even with that, I did another test this year because I was testing for something else. And my levels were okay in theory, but in terms of other things that we know, we're starting to see vitamin D can have an impact on your immune system, on your mood, even in terms of preventing some cancers, fertility in women. There's a lot of information out there. Ever since I can remember writing guidelines for vitamin D years ago, and there's always been like a jury out. But what we do know for a fact is, unlike other vitamins, it also has a hormonal role, and we know it does you a lot of good. And we also know Black people in particular need more vitamin D to have the same effect. So the general dose sometimes that is recommended isn't always adequate, kind of thing. So I always get people to take a bit more rather than a bit less, because I know the margin of safety, etc. But also, if you're on medications, we know drugs like ephedrine, for instance, can affect your levels of vitamin D, and some people will need to take. So medications, other conditions, weight, all those things can also have an impact. And so this is a really good example of, the impact of antiretrovirals and HIV on common nutrients that you need. And that's a common one. There are others I can think of. So then the next question is, how do we manage these side effects? What can we do from a practical point of view? So The top of the list is the clinician's role. The clinician has a really important role to play. And some of you, when you go for your clinic appointments, you have a conversation, they'll monitor, they'll ask how you're getting on, etc. And that's all part of it. But because of the way our health system works, sometimes there are limitations, and sometimes you may not be able to get through to clinics, you may not be able to speak to the person you need, or it may happen at a weekend, etc. And I guess that's one of the reasons I set up this service, so that there's also a safe place people can go outside clinic. And quite often they may recommend other medications that you can get over the counter. And obviously regular blood monitoring that will go on in your clinic, and regular appointments, clinician engagement. One of the things that I don't think is done very well in clinic settings is supporting healthy living. And that's because that's not the role. In secondary care, hospital setting, it's about keeping people alive, managing those people with specialist needs. And then primary care is meant to take care of the other things. That's the way our health system is set up. Unfortunately, in primary care, and I have this conversation a little bit with my GPs because I wanted to do a project in HIV, and it's like, well, we don't have that many HIV patients. In the grand scheme of things, this isn't really going to make a difference. You know, but I know, because of what I know it's important. And that's the challenge in a public health system where there's limited funding. This is part of the challenge we face. But I think we definitely need to do better in terms of supporting you guys with healthy living kind of thing. I mean, we believe in patient empowerment, but sometimes a bit of help and support is needed. So supplements. So I've spoken a little bit about some of the things drugs can do, etc. And this is why I think supplements have a role, but I think it needs to be done in a safe and informed way. If people are taking it, then at the moment, and sometimes we have conversations in practice about how bad the pharmaceutical industry is, etc. The supplement industry is on another level because it's a law of its own. There's no regulation, so they can say and do what they like. A lot of times you'll see a supplement and it's got 10 things, and maybe you only need 1 or 2 of those things. So this is one of the things I try to do in the pharmacy that I run, is really support people and advise people on what supplements to take, what ones not to worry about. Sometimes marketing has an amazing power on people. Someone came to me the other day, they were like, oh, they want this herb. And I was like, why do you want it? And the person was like, oh, I saw it advertised and I just felt like I needed to have it. You know, no clinical reason, nothing. That is the power of marketing. You know, so, but you would encourage people to talk and engage, because if something's doing good in your body, there's a chance it can do bad, and there's a chance that you don't need it as well. So just in terms of using things in a safe and effective manner, but they definitely, supplements have a role. I've mentioned vitamin D, there are others. I've put here with caution, because if you're going to take some of them, depending on what drugs you're on, you need to be careful in terms of the timing, in terms of how much you take, etc. So this is where sometimes support will be helpful, also in terms of why you're taking it and to make sure you get the results that you're looking for. Then we have antioxidants, and these help to reduce the level of stress. Remember at the beginning, I spoke about stress on the cells, the energy power of the house of the cells. That's where antioxidants come in. Probiotics is really becoming popular now, because probiotics is basically, our body has a lot of bacteria and organisms on us, and it's like a symbiotic relationship. They do us a lot of good, and we're finding that actually they do us even more good than we thought. So these are also can be useful supplements. But if you don't want to take a supplement, you can also take them in the form of fermented foods, because fermented foods also have good bacteria as well. So, and then herbs, you know, like someone was asking at the beginning, COVID-19, people say, I think, and I did something the other day and posted it on YouTube, and I've got another one coming up where I'm, you know, talking about herbs. Herbs, you know, sometimes gets a bad, you know, a bad rap. Herbs can be used as food, and I want people to remember that. You know, we take herbs as food. They've been used for years as food, and that's fine. That's a good thing. some of them also have medicinal qualities and can be used as medicine. So they're different from medicines because medicines are medicines, but herbs are food, you know, that also have medicinal qualities in them. And most herbs do more than one thing, you know, and most times this is the difference between some herbs that you take in a herbal form in its raw state and even a supplement or a medication. Medications tend to be really potent. It will do this one thing we know. So it's a lot easier to research, etc. Whereas herbs, if you think of an orange has got seeds, an orange has got fiber, it's got juice, it's got the skin, and every single part of the orange can be used. You know, you can use the skin, is rich in vitamin C. There's, you know, it's even got more vitamin C than the actual orange, and people use it on their skin. I use it to manufacture some of the stuff I use for my skin. And, you know, it's complete. It's like you can't beat nature, you know, and that's the difference. With some supplements and foods, they tend to be more potent, and that's why they're more risky if you're on medications in terms of how much is in there. You do have to be careful with herbs because some herbs, yes, can affect the way your liver works. In terms of making the liver work better, that can also lead to you know, it seeing the drugs you're taking as toxins and getting rid of them. And so your levels can plummet, and that can cause problems. And so for me, I feel as if it's not that people can't take these things, but they need to take it with support. You know, work with someone, take it, make sure you take the right thing, the right amount, in the right way, to get some benefits. Because even though there's a lot of herbs that we don't know, you can make an educated assessment of it, someone that has the right experience. And also you know what to look for. So you know what signs, and that person can tell you, okay, this is what you need to look out for. There were some patients that came to us where it was like, okay, this is unlikely to be a problem, but you need to be careful. This is what you need to watch out for. And that's what you get when you get it from the right source, kind of thing. But like I said, I definitely feel there's value in them. Then you've got aromatherapy, and this is more about oils and massages, essential oils, etc. We use it for skin. However, things like essential oils are very light. They can get into your skin. That's why some people say they can heal. I'm not too convinced about their ability to heal in certain respects, but I know that they can be good for your skin, your hair, and things like that. But you have to be a bit careful because they can be absorbed into your body. And then just some practical tips, I think. The approach you take will depend on what medication you're on. So it's really important to make sure you talk to the right person. But some of the other things you can do if you're getting some of those side effects is you can change, and this I guess is more for the short term. You can change the timing of the medications, like, you know, taking it a bit earlier or a bit later. Sometimes that can make a difference. How you time it around meals, maybe taking it with or after food or before food. You know, over the years, I've seen patients where just by tweaking the time they take it, it can help, you know, eliminate or at least reduce some of the side effects or the impact those side effects have on their quality of life. Keeping a diary, that's really important, just keeping a track of what's going on, how you're feeling, etc. Because sometimes we're all human, we forget things. And when you go to speak to a clinician, if you've got a diary, it jogs your memory and it helps that person to be able to help you more. Then in terms of weight, you know, so I think it's really important that we think about weight gain prevention. So when it comes to weight, there's preventing yourself from gaining weight by trying to maintain your weight, and also losing weight. You know, there are realistic and sustainable approaches. You know, I do consultations and also offer medications. There's medications for weight loss. Some people find that those are helpful in the short term, maybe. I don't believe in relying on it long term, but sometimes it can help you in the short term. whilst you implement a more structured routine to manage your weight. That's where I think they can come in quite handy, apart from people that obviously are really, really heavy or have really massive weight issues. But whatever approach you take needs to be sustainable. And so getting support, a bit like smoking cessation, the evidence says when you do it with support, you're more likely to be successful. But portion sizes, the type of foods, I mean, those are things that go without saying, really. And that really brings me to an end. I try to make sure I don't go over a set time. So I think at this point, I'll take any questions and I'll stop the recording and just stop sharing and just, you know, so we can just make it interactive and take any questions anyone has.